alaikum wa rahmatullahi ta'ala wa barakatuh. Viewers, you are onto your favorite channel, Mikia TV, once again, where we are bringing to you your health, your favorite health discussion, where our consultant neurologist, Dr. Abdullahi Shehu, discusses health issues, especially things that nowhere else would you find answers to. Last week we started discussion on hypertension. Dr. Abdullahi Shehu MBE took us through important issues we needed to know about hypertension. But time came up against us and we had to cut the discussion short. This week we are carrying on from where we stopped. I am your uncle, Ali Musa. Please stay tuned. This thing people talk about, they often associate diseases or illnesses like hypertension with people with weight and things like that. What happens to people who haven't got much weight?
Hypertension is common to all people. Whether you have overweight or you don't have overweight is very common. And the millions of people around the world who are not overweight and they have hypertension are all there, everywhere, in each country. So it's not a disease unique to people who are overweight. It is, however, very common in those who are overweight. And the reason is simple, that people who are overweight are assumed to have a lot of cholesterol in their blood, and the arteries are usually a bit narrower, so it takes a lot of pressure to pump blood through those arteries that are tight, and therefore that leads to the blood pressure being raised and puts strains on the heart and the rest of the organs as well. But even people who are slim can be hypertensive, and I've seen many of them.
But could the complications get worse for people who are overweight?
Well, yes. I mean, people who are overweight have high chances of other complications as well. And especially if somebody is overweight, it's got hypertension, they're susceptible to have diabetes type 2, they're probably, if they are smoking, their cholesterol is high, then sudden death from heart attack and from massive stroke is very, very common.
Doctor, if we look at people's lifestyle, people who are living with hypertension, what do we say about their lifestyle? How can they look into that with probably the intent of controlling that silent killer, as you refer to it?
Well, I mean, lifestyle changes can influence high blood pressure in majority of cases. And I think we as humans, we tend to ignore that. We tend to more or less concentrate on other factors around us that we think are more important rather than our own psychological well-being. What I mean by that is, if you look at the whole community now, almost everybody is under stress for one reason or another. Whether you are looking for something to eat and drink because your supplies are running out at home, whether you do not have basic amenities that you can say provides the comfort for life, whether somebody is ill that's close to you, whether your income is less, whether you're overworked at work, and whether you have stresses at home. And for women, obviously they're too busy, maybe the finance is also stretching, and many factors all there. People think too much. And when they think too much, they build all the anxiety factors into it. And when you have a lot of anxiety building and they leading to loss of sleep, you're secreting hormones in the body that eventually can lead to raised blood pressure. And if we don't measure it, we don't keep an eye on it, this can certainly cause problems long term. So I ask people to literally be very careful about their work-life balance, about how they relate to anxiety factors and how they consider other problems affecting them, whether they're making those problems more important than they are themselves. Because if somebody is taking a problem to be more important than himself, then of course they are not balancing the equation right. Because if they're not there or they're not healthy, that problem will still not be solved anyway. So the important thing is to look after themselves and sleep well and eat well and whatever, so that they can prevent hypertension from happening or affecting them. The other lifestyle changes that people need to consider is maybe dietary, because a lot of our cultures, especially in Africa and other societies which is non-Caucasians, we do eat a lot of salt. And our blood pressure readings can be correlated very much to how much salt we eat, and also how much fatty things we consume. So we have to be very careful how we monitor this and how we look into it, so that at the end of the day we're not trying to enjoy with the mouth but punishing the body to pay the price of what we are eating. And if we don't control that, then it will eventually control us, especially where medication can either be scarce or difficult to get or too expensive, or for whatever reason treatment compliance is poor. Then that actually solidifies the purpose. So, and anybody else who has a strong family history of hypertension must make sure that they are meticulously checking it regularly, in the sense that sort of their risk of having hypertension is much higher than in normal population. And the other large group of people who have their blood pressure checked and monitored if they go to hospital are of course pregnant women, and they need that to be checked on a regular basis. Those of our women who do not have the opportunity to go to the hospitals to be checked while pregnant, then obviously they run the risk of having high blood pressure, and might even lead to a disease that we call preeclampsia or eventually eclampsia, where they can actually lose consciousness and have a convulsion just before they deliver, and so on and so forth, which can be potentially damaging if not fatal. So there are many things that we need to be taking care of and making aware of, so that the lifestyle and how we use knowledge that we have, what we hear from the media or from the experts, actually guide us so that we can manage ourselves better and treat what is treatable, prevent what is preventable, so that at the end of the day we have better quality life.
Now, when we look at lifestyle of young people, a lot of young people today, you find so many of them probably suddenly dying. You find somebody suddenly collapsing and then they say it's gone. Could that also be associated with lifestyle, probably overworking, not taking enough rest?
When somebody drops dead suddenly, it's really very difficult to assume what the cause might be, unless you have an autopsy report of 100 people who drop suddenly and find the causes to be the same. It's premature for me and not right for me to say they're all dying because of blood pressure or related problems. But common causes of certain death may include hypertension related things. As I said, you can bleed in the head and collapse and die. You can have a heart attack and collapse and die instantly, and so on and so forth. So these are things that hypertension can contribute in, no doubt about it. But then other people may have what we call arrhythmias, which is irregular heartbeat, that they can die of. Other people may have a seizure that they can die of. And other people may have other factors that certainly may affect their breathing or ability for the heart to function, and they die as a result of that. So all these can cause sudden death. There are some congenital heart diseases or even acquired heart diseases that can lead to sudden death as well. So I can't ignore those as contributing factors, and they may or may not necessarily have any relationship to hypertension, but they do exist. And the important thing is, if people look after their health and they're monitored regularly by somebody who knows what they're doing, then at least they have the right advice and they can take heed. And whether it's taking medication if they've got a diagnosis, or preventing the problem, then that would be really helpful in preventing sudden death. I think other factors that we need to take into account is maybe some form of drug abuse and other things that young people do. So we can't miss on that, because there are some drugs that young people can take, and certainly they take excessive amount of it, from which they just don't wake up. So people have to be very careful about that as well.
So, Doctor, thank you so much for this very interesting discussion on hypertension. Lastly, you might probably want to advise policymakers, particularly governments, on how they can step in to probably introduce policies that would help people deal with this problem, particularly in countries that are up and coming like Nigeria.
I mean, it's difficult just to advise the government on management of hypertension or prevention of hypertension as in isolation, but generally as a health improvement itself, having access to healthcare wherever somebody is will be really, really important for the nation to make sure that is provided in Nigeria. So whichever locality is there somebody who has access to a blood pressure machine, who can measure it, who can advise whether it's high or not, and who can refer and advise on treatment. Equally, it's the government's role and responsibility to make sure that medications are available around the country and at an affordable cost, so that people can afford it. Because if you think that you have been diagnosed with hypertension and the cost of your medication is more than the cost of the food you eat on a daily basis, then I think millions of people in Nigeria will not be able to afford it. So it is the government's role to subsidize on some of these cheap drugs, because some of them are really cheap because they've been in existence for more than 50 years. So the many companies are producing them at a much cheaper cost. So at least one can make sure that drugs are available. And to my colleagues, the physicians and the people who treat hypertension, they need to be able to hopefully investigate and make sure they find the cause. And sometimes education is very important. In fact, not sometimes, a lot of the time is very important. And when I know, due to the sheer volume of work coming to the medical practitioners in Nigeria and other places where you see 100 patients waiting to see one doctor and outpatient, it's not easy to give them any counseling, to talk to them about lifestyle issues and things like that. But having information on social media now and in other sites that people can visit and have a look and listen, that will be very helpful. So programs like this might help with that. Equally, it's the government responsibility to make sure that the hospitals are catered for in managing the complications of hypertension and training the experts who can go around and manage people. But most of all, I think making the lives of people easier wherever they are, so they're not struggling to exist, will reduce the stress they have. And if politics and if leadership is about reducing stress on the people you serve, then that is the best way to support your community that you're trying to protect and working for. And if one is able to achieve that and have a more sane community, that at least they have some basic amenities around them, they're not struggling for food and shelter, they're not struggling for simple medications, then that will bring life a lot easier. And I'm sure many people will not be stressed under those circumstances, and the risk of hypertension will be much reduced, or at least can be detected early and treatment be given early, so that the complication rate can be significantly reduced.
Thank you very much, Doctor. We have come to the end of this show. Thank you so much, Doctor, for your time and for your very worthy pieces of medical advices to our audiences, and I'm sure they will make the best of them. We hope you'll be with us again on this show. Or on behalf of Dr. Abdullahi Shehu MBE and myself, Ali Musa, who produced and presented this show to you, and all those that have contributed making this show possible, I say to our viewers, please continue to subscribe, share and like our shows, and help us to keep Mikia TV going. Good evening. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.